why you shouldn't take one of those free hospital education classes.
Hi, I'm Brittany with Beautifully Connected. I'm a birth doula, massage therapist, and I practice herbals with the Wise Woman method. Welcome to my channel.
So I'm really passionate about childbirth education, but I have a beef to pick with all of the hospitals who give out these free childbirth education courses. I think that they can be a good resource to get you started on some education about birth, but in my opinion, in attending many of them, especially in my area, most of the hospital classes are teaching you how to be a good patient and how to pay attention to hospital policy. So I might have mentioned those words before, hospital policy, in previous videos. Hospital policy is basically a standard operating procedure that all of the nurses and doctors come up with to help keep their patients safe and happy. Hospital policy is not law. Many times, hospital policy isn't based in science or evidence. It's just something that they do, blanket for everybody, because it helps them stay in a routine and manage things a lot better. So I want you to understand you don't have to listen to hospital policy, and just because you heard it in a free childbirth education class from your hospital, it doesn't mean that that's what's best for you or that's an unbiased source of education. So I think the best way that you can get education is simply by reading and interacting with other people in your community. If you have the extra funds available, I really recommend to seek out the people in your community that you really jive with, talk to them, interview them, and take a childbirth education with one of your doulas, midwives, or childbirth educators that you have available to you in your area. If you live somewhere and you're not quite sure where the community is or how to find people, please contact me. My email is located on my channel, and send me a message. I can help you anywhere in the country, and I will try to get you more resources in the world. But I'm very passionate that you find people in your community who will teach you about birth instead of going to the hospital. So if you come to somebody like me, I'm gonna give it to you straight. I'm gonna tell you totally and unbiasedly what I think about everything, and I'm going to have research and medical opinion and evidence all to back up that information and those thoughts. If you go to the hospital, a lot of times they do sometimes have like education and evidence, but it's biased and it's through the lens of we're the hospital, we're the authority, and you need to listen to us. That's why I'm really passionate about independent childbirth education. It's unbiased and it's not from the hospital. So a lot of times these hospital courses are just what we want you to do to be a good patient at our hospital. And it's not a bad idea to take them. So when you go to these hospital classes, they are going to show you around the hospital. They're going to show you the rooms and talk to you about the different technologies that they have available for support for you. But again, they're going to really hit it home with the hospital policy and the things that they like to do to keep them comfortable in the hospital. So again, in a previous video, we just talked about how the child and infant and mother mortality rates are rising and rising in America for mothers, and especially for low-income and minority women. So if you're one of these people, or any woman who will give birth in a hospital setting, it's very important to arm yourself with the education that is unbiased. So if you feel like you need it, go ahead and take the free childbirth education class. But remember that it may be a biased source of information. So when you're looking for unbiased sources of education for childbirth, check out improvingbirth.org and evidencebasedbirth.com. Both of those are wonderful resources and websites that have a lot of studies linked into all of their information and articles. What we found is that evidence and practice at the hospital takes around 20 years to catch up to each other. So although new evidence is always coming out that supports different practice, it takes a long time for actual evidence to meet up with the practice at the hospitals. For some reason, people are really set in their ways at the hospital, and they just want to keep doing their routine and the things that they think will keep everybody happy and safe. However, it might not be the best decision for you. So go ahead and check out those resources, and then also look at The Birth Partner by Penny Simkin. This is a book that was written, I think, in the 80s. She is like one of the first doula goddesses ever imaginable, and she wrote a wonderful book that talks a lot about birth planning and partner support. If you're pregnant, start it now. If you're not pregnant, start it now. It's a thick book, so you're going to want to take some time to really read and digest all that information. And then, of course, find somebody in your local community to help you get that childbirth education that you need. A lot of us are willing to do childbirth education classes on payment plans and also discounted for many people. So just reach out to us. Many of us doulas, many of us midwives, we just live to want to help and educate and empower women. And then of course, if you have any specific questions about childbirth or labor or the options that you have at the hospital, go ahead and leave me a comment and ask me about these questions, because I'm more than willing to get on and make a video just for you so that you can have the education and support that you need.
Thanks for watching. Make sure you hit the subscribe button if you like this video. Also, if you have any questions about holistic health, be sure to put those in the comments for me.